Shaylynn Packard, Shelby, Pate, and Shea, Whitehead. Congestive heart failure does not mean that the heart has completely stopped working. CHF is a heart condition in which the heart is unable to pump adequate blood supply to the rest of the body. There are many causes of CHF, including coronary artery disease, hypertension, faulty heart valves, myocarditis, congenital heart defects, abnormal heart rhythms, and chronic diseases such as diabetes, hyperthyroidism, hypothyroidism, emphysema, and buildup of iron or protein. The diagnosis of congestive heart failure is based primarily on the knowledge of the patient's medical history, but also from various lab tests and a careful physical examination. There is no cure for CHF yet, but there are medicines and various treatments that help with the symptoms. Heart failure does not mean the heart has stopped working. Rather, it means the heart's pumping power is weaker than normal. With heart failure, blood moves through the heart and body at a slower rate and pressure in the heart increases. As a result, the heart cannot pump enough oxygen and nutrients to meet the body's needs. The chambers of the heart respond by stretching to hold more blood to pump through the body, or by becoming stiff and thickened. The heart muscle walls may eventually become weak and unable to pump adequately. Congestive heart failure, or CHF, is important because it was the most common cause of hospitalizations in the Medicare program and led to nearly 1.4 million hospitalizations and $17 billion in total spending in 2007 alone. As a person ages, the likelihood of developing CHF increases. There are more males than females that have this disease. Due to this, in 2010, CMS was empowered to penalize acute care hospitals financially for above median rates of all-cause readmissions within 30 days of discharge for patients with CHF, pneumonia, and acute MI. Due to the high hospitalizations for this disease, we should discuss its causes. There are many causes of congestive heart failure. CHF is a distinct condition from coronary artery disease. Whereas some patients have both, many patients with CAD do not develop CHF, and many patients with CHF do not have clinically significant CAD. Any of the following conditions can damage or weaken the heart and cause heart failure. High blood pressure is the force of blood pumped by the heart through the arteries. If blood pressure is high, the heart has to work harder than it should to circulate blood, and over time, this can damage the heart. Faulty heart valves can also cause damage to the heart by causing it to work harder. Heart valves keep blood flowing in the correct direction. If one is damaged, it causes the heart to work harder to keep blood flow regulated. Myocarditis is an inflammation of the heart muscle and is usually caused by a virus, which causes left-sided heart failure. Congenital heart defects can be another cause of heart failure. If the chambers or valves of the heart are not formed correctly, it can cause the heart to work harder and can lead to heart failure. Other chronic diseases such as diabetes, hyperthyroidism, hypothyroidism, emphysema, and buildup of iron or protein may also contribute to heart failure and can also have a major impact on the rest of the body. In order to diagnose someone with CHF, signs and symptoms must be identified.
Two of the main symptoms of CHF are fatigue and weakness. Other symptoms include swelling in the legs, ankles, and feet, swelling of the abdomen, rapid or irregular heartbeat, persistent cough or wheezing with white or pink blood tinged phlegm, sudden or severe shortness of breath when exerted or lying down, reduced ability to exercise, increased need to urinate at night, sudden weight gain from fluid retention, lack of appetite and nausea, difficulty concentrating or decreased alertness, elevated blood pressure, and chest pain if heart failure is caused by a heart attack. Older individuals may experience more vague symptoms such as sleepiness, confusion, and disorientation when the brain is unable to receive enough oxygen. It is difficult to discriminate between CHF and other problems because many of the symptoms are nonspecific, and the symptoms that are more common are less specific. There is no cure for CHF, but there are many treatments for the symptoms. Patients who suffer from CHF have to take medications for the symptoms, including digitalis, which is the only drug available that strengthens the heart's contractions. Another type of medication used is a diuretic. This prevents accumulation of the fluid in the body and makes breathing easier. ACE inhibitors may also be used to lower blood pressure and improve blood flow. Patients may also take intravenous medications called inotropes, which improve heart functions and maintain blood pressure. Sufferers might also undergo lifestyle changes such as quitting smoking, limiting alcohol intake, maintaining a healthy weight, tracking fluid intake, having a diet that is low in cholesterol and sodium, becoming more active, and maintaining stress. For severe cases, another treatment could be a heart transplant or a mechanical heart pump. This is a really invasive surgery that has a long waiting list. A less invasive treatment is to install a pacemaker to help regulate the heart.
Lifestyle changes and medication can help the patient live a better quality of life if they have CHF. There are new treatments available to patients that are prolonging their lives. Clinical trials have been performed to prove this. Patients with more serious forms of CHF have pacemakers, implantable defibrillators, to control life-threatening disturbances of heart rhythm. Some patients may also benefit from heart transplant, LVADs. Treating what caused the patient's chronic heart failure is also important. Heart failure can be worsened by abnormal heart rhythms, angina, heart attack, high sodium diet, infection, and incorrect medication dosage. Most of the time, heart failure is a chronic illness that gets worse over time. Some people develop severe heart failure. Medications, other treatments, and surgery no longer help at this stage.
When caring for a patient with CHF, there are many things to consider. Many patients are on varying drugs, but one common drug is a diuretic, which is a mandatory treatment for patients with pulmonary or peripheral edema. There are no alternative treatments. Diuretics improve cardiac function, exercise tolerance, and symptoms. These drugs should be given with an ACE inhibitor. A clear explanation of their condition and the effects of the diuretics, along with advice regarding weight monitoring and fluid intake, should enable informed patients to make appropriate changes to their diuretic dosage. The role of nurses can be to provide patients with education and support, thereby helping them cope better. Teaching self-care plays a major role in the prevention of CHF and chronic complications. Regarding the importance of self-care, the knowledge of the patients on CHF is very important in order for them to stay healthy. The self-care education to patients is the main duty of nurses. So it is recommended to be considered as the first nursing intervention regarding these patients. Many patients suffering from CHF complain of sleep disturbances. Studies have shown that the total duration of sleep is shorter and the sleep structure disturbed with frequent arousal. These sleep disturbances gave effects such as fatigue, listlessness, loss of concentration, and loss of temper, which all can lead to a need for daytime sleep, seclusion, and counseling. Information and education, both to patients and the next of kin, about the disease and sleep situation can help patients to better cope with sleep disturbances. Often, CHF patients develop sleep apnea, which is a poor prognostic sign. Increased afterload that follows the breathing disorder can lead to progression of the impaired heart
therefore creating a vicious cycle. One way of treating this is with a continuous positive airway pressure, or CPAP machine, or supplemental oxygen. Also, the nurse can provide the patient with sleep medications and make sure the patient does not sleep more than an hour or two during the daytime. It is also important that nurses understand how treatment affects the patient's life situations in order to influence their collaboration with the treatment.